Imagine for a moment that it is 7 o'clock in the morning, you have just woken up, and the first thing you do, almost by instinct, is reach for your glucose monitor. You have been careful, you have been disciplined. You avoided the sweets yesterday, you took your medication exactly as prescribed, and you even went for that walk after dinner. But as you look down at that small screen, your heart sinks. The number is 170, or maybe it is 200. You feel that familiar surge of frustration, that heavy cloud of exhaustion that settles over your shoulders. You ask yourself the same question you have asked 1,000 times. What am I doing wrong? Why does my body refuse to respond, no matter how hard I try? The truth I am going to share with you today is one that might shock you. The reason your numbers are staying stubborn, the reason your energy is hitting the floor by 10 in the morning, and the reason your clinical tests aren't improving might not be your lack of willpower. In fact, it might be exactly the opposite. It might be that the very breakfast you have been eating for months, convinced that it was the healthiest choice for your diabetes, is the exact thing that is sabotaging your health every single morning. I am not talking about a secret ingredient or a complicated chemical. I am talking about a humble, simple food that is sitting in your refrigerator right now. It is a food that you might have stopped eating years ago because someone told you it was dangerous for your heart. And while you avoided it, your blood sugar stayed high and your health remained stagnant. I am Dr. Ethan Cole. I am a specialist in clinical nutrition and the management of metabolic health. And today, I am going to reveal the complete, unfiltered truth about eggs and diabetes. This is a truth that science has been confirming for over a decade, yet it is a truth that has somehow failed to reach the majority of doctors' offices and patient consultations. When you finally understand how this works, you will never look at your breakfast plate the same way again. I know exactly how you feel. You are tired of being told to eat more whole grains and more fruit, only to see your glucose spikes get worse. You feel like your body is a machine that has broken down, and no matter how many parts you replace or how much fuel you change, it just won't run. But what if I told you the problem isn't your body? What if the problem is the information you were given? Wrong information acts like a silent poison, doing damage every single day while you think you are doing everything right. If you are ready to stop guessing and start seeing real, measurable changes in your glucose numbers, I want you to pay very close attention to what comes next. What I am about to show you can change your story starting tomorrow morning. Before we dive into the science, make sure you are subscribed to this channel. My mission here is to provide you with updated, evidence-based tools so you can take back control of your health without the false promises. Now, let's talk about why your morning routine is failing you and how one simple change can fix it. To understand why eggs are the ultimate weapon against high blood sugar, we first have to understand the war that is happening inside your body every time you eat. If you have type 2 diabetes or insulin resistance, your body has lost its ability to efficiently process carbohydrates. You likely already know this, but what most people don't understand is that your digestive system doesn't have to be a victim of the carbohydrates you consume. In the world of nutrition, we have a concept I like to call the protein break. Think of your bloodstream as a highway, and the sugar from your food as a fleet of cars trying to enter that highway all at once. If you eat a breakfast that is mostly carbohydrates, like a bowl of instant oatmeal, a piece of whole wheat toast, or a glass of fruit juice, it is like opening every gate at once. A massive surge of sugar floods your blood in just 20 or 30 minutes. This is the glucose avalanche. Your pancreas tries to keep up by pumping out insulin, but because of your condition, that insulin is either not enough or your cells are simply ignoring the signal. The result? Your blood sugar hits 250. Your veins feel the inflammatory stress, and you feel shaky, hungry, and tired just an hour later. Now, this is where the miracle of protein comes in. When you introduce a high-quality protein, specifically the protein found in eggs, it acts as a physical and chemical brake on your digestion. Protein slows down what we call gastric emptying. This means the food stays in your stomach longer and enters the small intestine at a much slower, more controlled pace. When you eat 2 eggs alongside a small amount of carbohydrate, the protein creates a protective barrier. It signals your body to release sugar into the blood, not as an avalanche, but as a slow, steady stream. Instead of that violent spike to 200, you might see a gentle rise to 130, followed by a smooth return to normal. You are essentially giving your pancreas a break and protecting your cardiovascular system from the damage that sharp spikes cause. Let's look at 2 real-world scenarios to see this in action. In the first scenario, Imagine you eat what the traditional healthy guides suggest, a bowl of oatmeal with a sliced banana and a glass of fresh orange juice. On paper, this looks natural and full of vitamins, but physiologically, this is a disaster for a diabetic. It is almost entirely fast-acting sugar and starch with zero breaks. Within 30 minutes, your glucose is skyrocketing and your body is in a state of metabolic emergency. Now, consider the second scenario. You have 2 eggs, scrambled or poached, served with half an avocado and a handful of sautéed spinach. In this meal, the protein from the eggs and the healthy fats from the avocado work together to create the ultimate stabilization team. There is no avalanche, your energy remains steady, your brain stays sharp, and most importantly, your glucose monitor shows a flat, stable line. Eggs are one of the most complete protein sources on the planet. They contain every single amino acid your body needs but cannot produce on its own. And here is the most important number you will hear today. The glycemic index of an egg is 0. An egg, by itself, cannot raise your blood sugar by even 1 single point. However, when combined correctly, it can prevent everything else on your plate from hurting you. This is the power of the biological brake. It is not just about what you eat, it is about how you manage the speed of your metabolism. And as we move forward, I am going to explain why the old fears about eggs in your heart were not only wrong, but they were actually preventing you from using the best tool in your kitchen to save your health. Now, I know exactly what is going through your mind right now. You are thinking, but Dr. Cole, what about my heart? My previous doctor told me to stay away from eggs because of the cholesterol. Won't eating eggs every day clog my arteries? This is perhaps the most tragic misunderstanding in the history of modern nutrition. For over 40 years, we have been told that eating cholesterol-rich foods like eggs leads directly to high cholesterol in the blood, which then leads to heart disease. Because people with diabetes already have a higher risk of cardiovascular issues, this advice was given with extra intensity to the diabetic community. Millions of people stopped eating eggs, thinking they were protecting their hearts, while their blood sugar continued to ravage their bodies. Today, I want to set the record straight with the actual science that has been updated over the last decade. Here's the first thing you need to understand. Your body is not a bucket that you simply fill with cholesterol. Your liver is a sophisticated factory. In fact, your liver produces about 80% of the cholesterol found in your body. It does this because cholesterol is absolutely essential for life. It is the raw material for your hormones, it is a vital component of every cell membrane, and it is crucial for brain health. When you eat more cholesterol from a natural source like an egg, your liver simply senses that and produces less of its own. It acts like a thermostat in a house. If the sun is shining and warming the room, the heater turns itself down. Your body is constantly seeking balance. Multiple large-scale studies published in leading European medical journals have shown that for the vast majority of the population, dietary cholesterol has a negligible impact on blood cholesterol levels. But there is an even deeper truth here. We have been taught to fear the total LDL number, the so-called bad cholesterol. But science now knows that not all LDL is created equal. There are 2 types of LDL particles. The first type is small, dense, and hard. These are the dangerous ones that get stuck in your arteries and cause blockages. Do you know what creates these small, dangerous particles? It isn't eggs. It is high levels of sugar and refined carbohydrates. The second type of LDL is large and fluffy, like a cotton ball. These particles move through your system without causing harm. Research shows that eating eggs can actually shift your cholesterol profile from the dangerous small dense type to the harmless large fluffy type. Furthermore, eggs have been shown to help increase your HDL, the good cholesterol, which acts like a vacuum cleaner, scrubbing your arteries and protecting your heart. When we told diabetics to stop eating eggs, they didn't just stop eating protein, they replaced those eggs with something else. Usually, they replaced them with heart-healthy cereals, toast, or low-fat processed foods that were loaded with hidden sugars. So while they were trying to save their hearts by avoiding an egg, they were actually destroying their hearts by flooding their systems with the very sugars that create dangerous cholesterol and systemic inflammation. It is time to stop fearing the egg and start fearing the misinformation that has kept you sick for so long. To help you see how this plays out in real life, I want to tell you about one of my former patients, a woman named Elena. Elena is a 55-year-old elementary school teacher from a small town in Ohio. When she first walked into my office, she looked defeated. She had been living with type 2 diabetes for nearly 8 years, and she was doing everything by the book. She told me, "Dr. Cole, I don't understand. I stopped eating red meat. I haven't touched an egg in 5 years. Every morning, I have a bowl of steel-cut oats with a little bit of honey and a sliced banana. I even drink a glass of fresh squeezed orange juice for the vitamin C. I take my metformin faithfully. But my morning numbers are always over 180, and my A1C is stuck at 8.5%. I feel like a failure." As I listened to Elena describe her healthy breakfast, I realized she was caught in what I call the oatmeal trap. She thought she was doing the right thing, but she was essentially starting her day with a massive sugar bomb. Even though steel-cut oats are better than instant oats, they are still a concentrated source of carbohydrates. When you add honey, a banana, and orange juice, which is essentially liquid sugar without any fiber, you are asking a diabetic body to do something it simply cannot do. Elena was experiencing a massive glucose spike every morning at 8 a.m. By 10 a.m., her sugar would crash, leaving her exhausted and reaching for a healthy granola bar, which started the cycle all over again. Her liver and her pancreas were under constant attack. I looked at Elena and said, "I want you to try something that might scare you. I want you to throw away the oatmeal for 2 weeks. I want you to eat 3 eggs every morning. You can scramble them, poach them, or boil them. I want you to eat them with half an avocado and some sautéed peppers or spinach. And I want you to replace that orange juice with plain water or black coffee." She was terrified. She asked me, "But what about my cholesterol?" I explained to her exactly what I explained to you in the previous section. I told her that her current breakfast was actually the cause of her high cholesterol because the sugar was triggering inflammation and the production of those dangerous small LDL particles. Elena agreed to the challenge. 3 days later, she sent me a message. She said, "Dr. Cole, I thought my monitor was broken. This morning, 2 hours after my egg breakfast, my sugar was at 130. I haven't seen a number that low in years." Over the next 3 months, the transformation was nothing short of miraculous. By replacing the oatmeal trap with the protein break of eggs, Elena's body finally had a chance to heal. Because the eggs kept her full and satisfied, she stopped snacking between meals. Her energy levels stabilized, and the brain fog she had lived with for years finally lifted. When we did her follow-up blood work at the 90-day mark, her A1C had dropped from 8.5% to 7.2%. But the most shocking result for her was her lipid panel. Her bad LDL had actually gone down, and her good HDL had increased for the first time in a decade. She wasn't a failure, she was simply a victim of the wrong strategy. Elena's story is a powerful reminder that when you give your body the right fuel and the right biological brakes, it knows exactly how to move toward health. Up until now, we have talked about eggs primarily as a source of protein and a way to stabilize your blood sugar. But I want to take you deeper into the shell. I want to talk about why an egg is not just a food, but a biological masterpiece of nutrition. In my medical practice, I often refer to the egg yolk as liquid gold, and yet, for decades, the standard advice for diabetics was to throw the yolk away and eat only the whites. This was a catastrophic mistake. When you throw away the yolk, you are essentially throwing away the most powerful medicine in your kitchen. The white is certainly a good source of pure protein, but the yolk is where the life-giving nutrients reside. Let's break down exactly what is inside that yolk and why it is specifically designed to fight the complications of diabetes. First, let's talk about a nutrient called choline. Most people have never heard of it, yet it is one of the most important compounds for metabolic health. People with type 2 diabetes are at a significantly higher risk for developing non-alcoholic fatty liver disease. When your liver is clogged with fat, it becomes even more resistant to insulin, creating a vicious cycle of high blood sugar. Choline is the essential nutrient that helps your liver export fat and process it correctly. Eggs are the single best dietary source of choline in the world. By eating the whole egg, you are directly supporting the health of your liver, which is the command center for your blood sugar. Next, let's look at vitamin D. We are currently facing a global epidemic of vitamin D deficiency, and research consistently shows that people with diabetes have much lower levels of this sunshine vitamin than the general population. Why does this matter? Because vitamin D is not just a vitamin, it acts like a hormone that improves the sensitivity of your cell's insulin receptors. It makes the lock and key mechanism of insulin work more smoothly. If you are deficient in vitamin D, your insulin cannot do its job, no matter how much your pancreas produces. The egg yolk is one of the few natural food sources of vitamin D, But perhaps the most important reason for a diabetic to eat the whole egg is the protection it offers your vision. One of the most terrifying complications of long-term high blood sugar is diabetic retinopathy, the damage to the small blood vessels in the eyes. Egg yolks are rich in two specific antioxidants called lutein and zeaxanthin. These compounds are selectively absorbed into the macula of your eye, where they act as internal sunglasses, filtering out harmful blue light and protecting the delicate tissues from oxidative stress. When you have diabetes, your eyes are under constant attack from sugar-induced inflammation. The nutrients in an egg yolk provide a natural shield for your sight. Finally, we have the B-complex vitamins, specifically B12 and folate. Many diabetics take metformin, and while metformin is a very useful medication, one of its well-known side effects is that it can deplete your body's levels of vitamin B12 over time. Low B12 is a leading cause of peripheral neuropathy, that painful tingling, numbness, or burning sensation in your hands and feet. By including whole eggs in your daily routine, you are providing your nervous system with the raw materials it needs to repair nerve sheaths and prevent that debilitating pain. When you look at an egg now, I don't want you to just see a breakfast item. I want you to see a multivitamin, a liver protector, an eye shielder, and a nerve healer, all wrapped in one perfect package. Now that you understand the why, we need to focus on the how. Not all egg dishes are created equal. In fact, the way you prepare your eggs can mean the difference between a meal that heals your body and a meal that causes unnecessary inflammation. In many parts of the world, and especially in the traditional Western diet, we have a habit of taking healthy eggs and surrounding them with inflammatory triggers. We fry them in excessive amounts of vegetable oils, we serve them alongside processed meats like bacon or sausage, and we pile them on top of white flour toast. If you do this, you are neutralizing the benefits of the egg. The first rule of the Ethan Cole Kitchen is to be mindful of your fats. The egg yolk already contains a perfect balance of natural, healthy fats. You do not need to add more. When you fry an egg in a pan of shimmering oil, even if it is olive oil, you run the risk of oxidizing those fats at high temperatures. Oxidized fats create systemic inflammation, which is the last thing a diabetic body needs. Instead, I want you to master the art of the dry scramble or the water poach. If you have a high-quality non-stick pan, you can scramble your eggs on medium heat without a single drop of added oil. Simply whisk them gently, pour them into the pan, and move them slowly until they are creamy and soft. If you prefer more flavor, you can use a tiny amount of grass-fed butter or a light spray of avocado oil, both of which have higher smoke points and are more stable under heat. Boiling is another fantastic method because the shell protects the nutrients from oxygen and light during the cooking process. I recommend my patients keep a bowl of hard-boiled eggs in the refrigerator at all times. They are the ultimate safety net. When life gets busy and you are tempted to reach for a sugary snack or a piece of bread, you can grab 2 hard-boiled eggs instead. They are portable, they stay fresh, and they provide an instant dose of that protein break we talked about earlier. But there is a secret technique that is even more powerful than how you cook the egg, and that is the sequence in which you eat your food. This is what I call the golden rule of sequencing. If your breakfast includes eggs, some vegetables, and a small portion of a complex carbohydrate like a slice of sprouted grain bread, the order in which those foods hit your stomach changes everything. If you take a bite of toast first, the refined starch immediately begins breaking down into glucose in your mouth and stomach, entering your blood almost instantly. But if you eat your eggs first, the protein and fats coat the lining of your stomach and trigger the release of a hormone called GLP-1. This hormone slows down the movement of food through your digestive tract. By the time you get to that piece of toast 10 minutes later, the protein break is already fully engaged. The sugar from the toast is forced to wait in line. It is absorbed slowly, bit by bit, preventing a sharp glucose spike. This simple change, eating your protein and fiber before your carbohydrates, can reduce your post-meal blood sugar spike by as much as 30 to 40%. It is a biological hack that costs nothing but provides a massive return on your health. As we move forward, I'm going to show you how this looks in practice with another real-world story, and we will identify the hidden sugar traps that might still be lurking on your breakfast table, waiting to undo all your hard work. To further illustrate why the company your eggs keep is just as important as the eggs themselves, I want to share the story of Julian. Julian is a 60-year-old architect from Chicago who came to me about 7 months ago. Unlike Elena, who was eating oatmeal, Julian loved his eggs. He told me, "Dr. Cole, I eat 3 eggs every morning. I use olive oil. I have a few strips of bacon for extra protein, and I drink a glass of fresh orange juice because I thought I needed the vitamins to stay healthy. But my numbers are still a disaster. My fasting glucose is consistently over 180, and I feel exhausted by noon. Julian's situation is what I call the healthy illusion. He thought he was doing everything right because he included the eggs, but he was surrounding them with metabolic saboteurs. Let's look at his breakfast through a clinical lens. First, the bacon. While bacon is a protein, most commercial bacon is a nitrate trap loaded with sodium and hidden sugars used in the curing process. For a diabetic, high sodium intake leads to increased blood pressure and fluid retention, which further stresses the cardiovascular system. Second, the orange juice. This was the biggest culprit. I told Julian something he didn't want to hear. Fresh squeezed orange juice is essentially a soda with a better marketing team. When you juice an orange, you remove the fiber, which is the natural break the fruit provides. What you are left with is a glass of concentrated fructose that hits your liver like a freight train. Fructose is particularly dangerous for diabetics because it promotes insulin resistance in the liver faster than almost any other sugar. Julian was eating his protein break, the eggs, but then he was immediately washing it away with a flood of liquid sugar. The juice was winning the race to his bloodstream every single time. I asked Julian to make two specific changes. First, he had to stop the juice immediately. If he wanted the flavor of an orange, he had to eat the whole fruit, fiber, pulp, and all. Second, he replaced the bacon with half an avocado and a handful of walnuts. This shifted his breakfast from a pro-inflammatory meal to an anti-inflammatory powerhouse. Within 2 weeks, Julian experienced what he called his awakening. He realized that for years he had been blaming his body for not responding to the eggs, when in reality, the juice and the processed meats were sabotaging the egg's ability to work. When he removed the liquid sugar, the eggs finally had the chance to stabilize his system. His energy levels didn't just improve, they soared. He stopped needing his mid-afternoon nap and his focus at work returned. By his 4-month checkup, his A1C had dropped from 8.7% to 7.5%. Julian's story proves that eggs are a powerful tool, but they cannot be expected to fix a meal that is already broken by liquid sugar and processed additives. As we reach the conclusion of our journey today, I want to share a secret that most people, and even many doctors, overlook. We have spent most of our time talking about breakfast, but eggs have a superpower that is best utilized in the evening. Many of you likely struggle with what we call the dawn phenomenon. This is when you go to bed with a decent blood sugar number, but you wake up with a high one, even though you didn't eat anything while you were asleep. This happens because your liver, sensing that you are in a fasting state, begins to release stored glucose into your blood to give you energy for the coming day. In a diabetic body, this release is often aggressive and uncontrolled. However, research has shown that consuming high-quality protein and healthy fats in your final meal of the day can actually signal the liver to slow down this overnight glucose production. I have found that patients who eat 2 eggs and a large portion of green vegetables for dinner often see a drop of 15 to 20 points in their fasting morning glucose compared to when they eat a dinner based on pasta, rice, or bread. By choosing eggs for dinner, you are essentially setting the protein break for the entire night while you sleep. Now, I want to give you a concrete roadmap that you can start using tomorrow morning. For the next 7 days, I want you to follow this simple structure. For breakfast, you will have 2 to 3 eggs. No oil, use a non-stick pan or boil them. Pair these eggs with half an avocado and a generous portion of fiber-rich vegetables like spinach, peppers, or broccoli. If you absolutely must have a piece of toast, it must be the very last thing you eat. No juice, no sugar in your coffee. If you feel hungry between meals, your emergency snack will be 1 hard-boiled egg and 5 or 6 almonds. This will keep your glucose stable until your next meal. For dinner, at least 3 times this week, try replacing your usual starch, the potato, the rice, or the pasta, with a 2-egg vegetable omelet. Before you start this journey, I have a very important medical reminder. If you are taking medication like metformin, eggs are perfectly safe and will not interfere with your prescription. However, if you are using insulin or other medications that can cause hypoglycemia or low blood sugar, you must speak with your healthcare provider before making these changes. Because this way of eating is so effective at lowering your blood sugar, your current dose of medication might actually become too strong. You must work with your doctor to monitor your numbers and adjust your dosages as your body becomes more efficient. I also want to address the question of quality. People often ask me if they must buy expensive organic, pasture-raised eggs. My answer is this. If you can afford them, yes, pasture-raised eggs have higher levels of omega-3 fatty acids and vitamin D. But please, do not let the price of organic eggs stop you. A conventional egg from your local supermarket is still 1,000 times better for your diabetes than a healthy bowl of cereal or a piece of toast. The benefits of the protein and the choline are present in every egg, regardless of the label. You have the power to change your health. You have the power to stop the glucose roller coaster and start living with the energy and clarity you deserve. For years, you may have looked at the eggs in your refrigerator with fear or suspicion. Today, I am asking you to look at them as your greatest ally. I want to hear from you. Which of these changes are you going to implement first? Are you going to try the protein break tomorrow morning? Or are you going to try eggs for dinner to fight the dawn phenomena? Leave a comment below, and let's start a conversation. If you found this information valuable, please share this video with someone you love who is struggling with their numbers. I am Dr. Ethan Cole. It has been a privilege to share this science with you today. Remember, your body has an incredible capacity to heal when you give it the right information and the right fuel. Take that first step tomorrow morning. I'll see you in the next video.